Hello friends, I am Dr. Rahul Patil, consultant cardiologist, Revascularization Clinic, Pune. Today I am going to discuss with you regarding a new therapy which is recently made available in Pune, ESMR, which is Extracorporeal Shockwave Myocardial Revascularization. I am going to talk on patients of heart diseases. Heart attack is one of the major cause of death in India. After any person who survives from a heart attack, he goes for an investigation called as coronary angiography. This coronary angiography is done at many places in Pune and all across India today. After coronary angiography, then the dilemma comes, the treatment part, where a person who has blocks inside requires maybe a medical treatment, angioplasty or a bypass surgery. But then there are certain class of patients who are labeled as no option patients. Who are they? The patients who have severe bad dysfunction of a heart, where the heart pumping capacity has gone less than 30%, 20%. So these are the patients who are extremely high risk for bypass surgery or angioplasty. So this patient is called as no option patient. If I do a procedure on him, he may have a very high risk of mortality during the procedure. And second patient is the patient who has multiple blocks in the heart with associated renal failure, means associated kidney disease where blood urea and creatinine levels are high, and these patients are likely to worsen their kidney failure during operation or for bypass surgery or maybe an operation of angioplasty. So this is again a no option patient. Then third class of patients who are really scared of doing a procedure and they don't want to do it. So these are very few patients because they understand the importance of angioplasty and bypass surgery, which is a definitive treatment for. So I am going to talk on these no option patients. A patient who is elderly, 75 years of age and above, and who has multiple blocks, who cannot go for bypass and angioplasty because of his old age. There are certain diseases like the patient who has associated blood disorder where your platelet count or a blood count is so low that patient carries a high risk of during the procedure of bypass or angioplasty. So these are all high risk patients for or no option patients for angioplasty and bypass surgery. So today, scientifically looking at these all patients and their nearby relatives, they always think of giving some better option to their patients. So a cardiologist or a physician usually keep prescribing their medications which are definitely important for the treatment of a patient, but then they always try to seek something better than medicines, and they end up with doing treatment like chelation therapy, some Ayurvedic treatment, Hridayam, something which is said that it will remove blocks from the heart, some homeopathy medications, some kadas, some Bondhu Baba's medicine. So these all medications, they said to be remove the blocks, but then after 1 or 2 years this patient, they come to us after taking these medications. These patients have worsened their blocks and we have never seen these blocks gone from their heart after repeat angiography done for these patients after that therapy. So today I am going to talk on a new therapy called as ESMR. This is a therapy which is invented in Germany, and this therapy uses a hydroelectric crystal which is applied in an applicator which I am going to show you in a video. This applicator has this hydroelectric crystal which will generate acoustic shock waves into the chamber of that probe, which is directed almost 2 millimeter area of a heart where the blocked artery is seen, and when this shock wave is directed towards the heart in the area which is deprived of blood supply, this shock wave will help in generating new blood vessel formation. When these shock waves are given transiently, it causes vasodilatation, means dilatation of blood vessel. But when these shock waves are given in a titrated dose for 9 consecutive sessions in a duration of 1.5 months with a 2 weeks blank period in between, it has been shown in various studies and trials that this shock wave or a ESMR helps in improving new blood supply formation to the heart, what we call it as collateral formation. So when the blocked artery is given shock, it generates new blood vessel formation and it forms natural bypass or a collateral circulation, and most of the studies which are done for the ESMR are published in index journals of European Society of Cardiology, American Society of Cardiology, Journal of American College of Cardiology, Journal of European Society of Cardiology, World Heart Federation Journal. So these are all literatures of ESMR which are published in these renowned journals, and these journals are very authentic, and they say that this ESMR appears to be a very good therapy in patients who are no option patients. So this therapy is a non-invasive therapy where I do not give any injection to the patient. It is given from outside without any anesthesia. It is an OPD basis treatment where patient comes on outpatient basis, stays in a hospital or maybe a clinic for 1 hour and then goes. This shockwave therapy, as you see in the video, is applied through a chest wall with the help of a probe. Patient himself do not feel any shock as a perception. He just lies down on a couch, he do not feel any shock, but then these acoustic waves, they are directed to the heart to get generation of new blood vessels. These studies are done in the human beings with multiple blocks, and especially in no option patients, especially post bypass patients whose bypass are graft, especially those patients who cannot go for angioplasty and bypass surgery, and it has been proven that this patient has improved their functional capacity of heart, has improved their functional class of symptoms of angina, symptoms of heart failure, especially those patients whose pumping capacity is low, has shown improvement in their pumping capacity. So ESMR has come as a new way to the patient who are no option therapy patients in the treatment of improving blood supply to the heart in a scientific way and a proven way. So as a cardiologist, I will recommend this patient treatment, especially for no option patients who do not go for bypass or angioplasty, can go for this therapy which is very good. Now talking about any side effects about this treatment, most of the trials which are done in this with this ESMR has shown no adverse effect on the heart or blood vessels or the pumping capacity of heart or the symptom worsening in the patients. So this therapy has proven to be non-invasive, very safe, no side effects and excellent outcome in the patients who are no option patients for bypass surgery and angioplasty. Thank you very much.